Hi there, this is Dr. Michael Margolis from Racing MD. Today we're going to talk about, does laser tattoo removal hurt? Pain is very subjective. Pain is a personal perception. Everyone experiences it a little bit differently. There is a minimum amount of discomfort involved in any type of laser procedure. Luckily, laser tattoo removal is of a short duration. The sensation that people often experience during laser tattoo removal is similar to a rubber band snapping against one's skin. We need to talk a little bit about the anatomy of the skin to understand what modalities we can employ to minimize any type of discomfort. Here we're looking at an illustration of the skin in cross-section, and you see that there's two layers that are commonly referred to as the skin, the epidermis, and the dermis. Unfortunately, the tattoo ink typically is found in the dermis in fibroblast cells. So in order to provide appropriate anesthesia, you have to anesthetize both the epidermis and the dermis itself. So our goal is to decrease the pain, and what we use is something called a chiller. Here we're looking at the Cryo 6, which is what we're using at Racing MD, and this is blasting negative 32 degrees Celsius air onto the skin. Luckily, this can be used both prior to the treatment, during, and after. Other modalities that are used for pain control would be cryogen sprays, ice packs, but unfortunately these cannot be used during and immediately after. In my opinion, the chiller is highly effective. In fact, talking to any patients that had any type of laser procedure, whether it's hair removal or tattoo removal, with and without the chiller, they all tell you the chiller makes a big difference. I would say I would try to avoid any type of laser procedure without the use of a chiller. And of course, we can use things in combination. Sometimes we pre-treat the area with prescription topical anesthetic cream, which is applied 2 hours before the laser session. It is simply wiped off, then the chiller is employed, and then the tattoo is removed. And we also have the option in certain circumstances to perform regional pain block or to inject lidocaine to provide local anesthesia that renders the area itself numb. I think in the end, pain is not an issue. The procedures themselves are quick, and the use of the chiller is highly effective at providing regional anesthesia. I think most people leave the office and are surprised how well the chiller works. As always, this is Dr. Michael Margolis from Racing MD.